prostate cancer is the most common malignant disease in men. In 2020, more than 60,000 cases of prostate cancer were newly diagnosed in Germany, and about 1 in 5 of these men, or approximately 20%, died from this disease. In the following video, I will explain how prostate cancer develops, what symptoms may occur, and which risk factors play a role. My name is Stephan Neubauer. I am the chief urologist at the West German Prostate Center, here at the clinic at the Ring in Cologne. Prostate cancer is a malignant disease of the so-called prostate gland. The prostate, like the testes, epididymis, and seminal vesicles, is part of the male reproductive organs. It consists of about 40 to 50 sperm-producing individual glands that are embedded in muscle and connective tissue. The healthy prostate of a young man is, on average, about the size of a chestnut or walnut and is located between the bladder and the external bladder sphincter. On the sides are the so-called seminal vesicles, and behind the prostate is the rectum. This is the reason why the prostate can be easily accessed during a physical examination through the rectum. More than 90% of all prostate cancers arise from glandular cells and are therefore referred to as adenocarcinomas. The rare remaining prostate cancers can also develop from other cells of the prostate tissue, such as muscle cells. The malignancy of prostate cancer, also referred to as malignancy in medicine, depends on the type of tumor and how much and how strongly the tumor cells differ from the normal tissue of the prostate. In contrast to benign enlargement, the tumor usually develops in the outer zone of the prostate, which is why prostate cancer rarely causes symptoms and can remain undetected for a long time without regular screening examinations. Affected individuals often only experience subjective complaints when the tumor has progressed to the point that it constricts the urethra. Here, as with a benign enlargement, there is a strong urge to urinate and frequent urination. But blood in the urine or semen, or pain during sexual intercourse in the pelvis, back, or hip can be signs of advanced prostate cancer. Whether a man will develop prostate cancer in his lifetime cannot be predicted. Although the causes of its development and progression are largely unknown, there are certain factors that have been shown to increase the risk. Primarily, age is a significant factor. On average, patients diagnosed with prostate cancer are 72 years old. Younger men are relatively rarely confronted with this diagnosis. Nevertheless, it still occurs that young men become ill, making regular screening all the more important, as cancer in younger individuals is usually more aggressive and progresses more quickly. We also know today that there can be a hereditary burden in prostate cancer. If a man has a father or brother who has already been diagnosed with prostate cancer, the risk of developing the disease himself doubles. The ethnicity of a man also plays a role. Men of sub-Saharan African descent are more frequently affected than Europeans or white North Americans. In contrast, Asians are rarely affected. There is little reliable knowledge about lifestyle or environmental risk factors. However, maintaining a normal weight and engaging in sufficient physical activity can significantly reduce the risk of prostate cancer. The speed at which a tumor in the prostate grows and whether it spreads to other tissues or organs depends, as with any other cancer, primarily on the size and aggressiveness of the tumor. In general, it can be said that prostate cancer typically grows more slowly than other tumor diseases due to its occurrence mainly in older age. Therefore, we also have a good chance of detecting very early stages of prostate cancer during screening. To detect very early stages when the tumor is still confined to the prostate, in such cases, we refer to localized prostate cancer. About 90% of these tumors are curable with established methods such as internal radiation, known as brachytherapy, external radiation, or surgical removal. The prognosis is somewhat less favorable for tumors that have already breached the prostate capsule or have reached the connective tissue or seminal vesicle outside. But even at this stage, a cure with modern forms of radiation therapy is often still possible. In some cases, prostate cancer has already spread and form deposits known as metastases by the time of diagnosis. This means that cancer cells have settled in lymph nodes, bones, or other organs. The cancer disease is usually no longer curable for those affected. Nevertheless, with modern medications and local therapy methods, a long and symptom-free lifespan can often be achieved. If you would like to learn more about the prevention, diagnosis, or treatment of prostate cancer, please feel free to make an appointment here with us at the West German Prostate Center in the clinic at the Ring. We look forward to seeing you.